Honorable Minister for Australia for Health and Honorable Minister for Health for Government of India. Sir, let me welcome both the Honorable Ministers. To kindly introduce myself, I am Love Agarwal, Joint Secretary International Health. And sir, without taking much time, can I kindly request Honorable Minister for Health for India to give the introductory remarks, please?
Good morning. Good morning. I know it's a good evening there right now. So, how are you, Mr. Greg? It's a pleasure for me to have this meeting with you, which was long overdue, and it's a great feeling talking to you right now. I don't know whether you can recognize me. I can remove my mask for the time being, and then I'll wear it again.
There we go.
Thank you.
I recognise you from the pictures, and when you were appointed, I read about your very distinguished background. So I think India is lucky to have you, but it's I know how hard it is. As difficult as it is in Australia, you are of course dealing with even greater challenges. So it's a busy, challenging time for all of us.
Thank you so much. I've known about you quite a bit. You are a distinguished lawyer and a distinguished politician, and many of the things between both of us resemble as far as our political life is concerned. You have been, right now you are the health minister, I am the health minister. You have been earlier the science minister. I am presently also the Science and Technology Minister, also the Minister for Earth Sciences. You were earlier the Environment Minister, and I also headed this ministry for almost 2.5 years in the last term of our Prime Minister Narendra Modi ji. And I was very impressed when I read that in your own constituency, you have organized 5 kilometers walk 5 times in a row, especially for the this autism spectrum disorder patients, and especially to organize donations for juvenile diabetes. I think that's a very, very impressive background that you have, and you have a very ambitious plan to have the best health system in the whole world for your own country. That's pretty impressive. Australia, we know, is a very developed country with a lot of, I think, good things that we also keep reading. We also keep following them for a long time. Some of my close relatives, they live in Australia, so they keep telling me about what happens in Australia. I had the privilege of visiting Melbourne in 2006 when we had the Commonwealth Games, at the time of the Commonwealth Games. So it's a great feeling, and I know that we have a very good agreement to work together in the field of health, which we had signed together in 2017. I was told that it was followed up with one meeting of the joint working group in New Delhi, and since then I think last two years or so, we this next meeting is also long awaited.
Yes.
So we would number one like to sort of decide today that we continue with that dialogue of working together, that close cooperation and all the good things that we intend to do. Just to give you a brief idea about the focused activities that we are doing in India. One of our most ambitious program is the program which is strengthening the universal health coverage issues, and this is basically probably one of the most ambitious programs of the whole world, where almost 100 million families and 500 million people that way are provided good quality health coverage treatment for even the tertiary care in the best hospitals in India for the poorest of the poor. And already we have helped over 10 million people, poor people, in the last 1 year or so. And we are ambitiously looking forward to eliminate diseases like tuberculosis 5 years earlier than the international goal. There is a lot of emphasis on the traditional systems of medicine in India, especially yoga and Ayurveda, and there is also a focus on the health of the women, children, and also the adolescent. We are developing health as a social movement by creating 1.5 lakh health and wellness centers all across the country, even in the remotest part, where the focus is on prevention, promotion, and positive health, curative services. All those things are available at one place. And there is a massive screening program all over the country for the non-communicable diseases like hypertension, diabetes, and then of course cancers like the cancer of the oral cavity, cancer of the cervix, cancer of the breast. So that's another big activity we are doing to strengthen basically the. And then there is a focus, that's one area where we can work together further, is about the digital health program. That's a we have already developed the national digital health blueprint, and a lot of activities are going on this front very proactively. We are working very aggressively to leverage new technologies. Since I am the Science and Technology Minister, so I am trying to blend the fruits of science and use them for health, for making better the health outcomes. And all those things like artificial intelligence, data analytics, Internet of Things, and also we are trying to use science for health in a big way. And because of the focus on the women's health in recent years, we have reduced our maternal mortality rates and the under 5 mortality rates faster than the global averages. There are some ambitious programs like providing drugs, the generic drugs, at almost, you would say, 50 to 90% lesser price than the price that is written on the drugs through our services. That's we call that as the Jan Aushadhi stores, people's medicine stores all over the country. We have created some 5,000-6,000 of them in the whole country, where the people get the generic drugs at very cheaper prices. There is another program where we are ensuring that even the medical devices are provided to the, whether it is the implants or whether it is the stents that we use for coronary angioplasties. There also there is a program that is called the Affordable Medicines and Implants, Reliable Implants Treatment Program, that's called Amrit. So in fact, I would say that India is right now under the leadership of Prime Minister Narendra Modi. We are number one, moving towards a digital India. We have a Prime Minister launched a massive program for financial inclusion, and through that almost 400 million poor people, they got bank accounts. And then everything that is you see required, it is transferred directly into the bank accounts of the poor people in a big way. So there are a lot of things happening here in India, but I know that Australia is one of the most livable and the most loved country by many. Those who have got in contact with Australia, they adore Australia. And you know, I know that you have a very advanced, very well organized health systems. You have yourself developed very good connectivity with all sections of the stakeholders, whether it is the patients or the professionals or the pharmacists or the government organizations. I've read quite a bit about you and the dynamism that you possess. and the ambitions that you have to make the healthcare system of the of Australia the best in the whole world. And this is a similar. Ours is a very big country, 1.35 billion, but we have a very ambitious Prime Minister, and we also have a dream of doing the best for our countrymen. Use the best happening anywhere in the world, share the experience with other countries, and try to utilize that best happening anywhere in the world and use it for our own people. So this is where I look at our relationship with Australia to yield us very rich dividends in the future times. We already have officially the memorandum of understanding, but now we have to take it forward in a very, very dynamic manner. Regarding the coronavirus, I think that's unfortunately everybody in the whole world is suffering from that. You have, you are certainly slightly, I think, slightly better than the your own your neighboring country, New Zealand. At one point of time, they had we were told they got rid of the virus completely, but then it re-entered. Australia also, it is like waxing and waning, but by and large things are. In India also, I can say that we started the attack or the fight against the virus probably at the earliest date in the whole world. We started it on the 8th of January when the whole world was informed about it on 7th of January by WHO. And since the beginning, India has adopted a very proactive and a preemptive and a graded sort of response using all possible tools that we had, huge community surveillance activities, huge point of entry surveillance activities, huge creation and expansion of our infrastructure, and also the expansion of the lab testing facilities all over the country. You will be happy to know that when we started the fight, we had one lab in the country which could test the virus, this particular virus, and now we have a capacity of more than 1200 laboratories in the whole country spread across you see all cross sections of the society, and right now at the end of almost it's almost over 6 months now, we have the least fatality rate, something like between 2.6 and 2.7, 2.64 to be very precise. And in a country of 1.35 billion people, we have not even reached the 1 million mark on the number of cases. The fatality, this recovery rate has gone up to over 63%. Most of our patients who are still in hospitals, they are, you see, on road to recovery. We have created over 14,000 dedicated COVID hospitals and COVID health centers, and also COVID care centers, where we have almost 14 lakh beds dedicatedly created all over the country for COVID management. And over and above this, we have almost I would say almost 10 lakh beds created in the quarantine centers also. So it's like it's a huge capacity that we have built up. We are all jointly all over the world. We know we have the same issues, same problems, same way of handling the issue, but still there are best practices in every country, in every, even within our country. Some of our states have very good practices which we share with the others and ask them to emulate. So I think we are meeting at a very critical and very difficult time when the whole world is affected by COVID. But this is the time when we have to also bring back our attention to non-COVID issues and non-COVID patients, and then the other services that the people need and deserve, and then revive the. So this meeting is happening at a very crucial time, and we can probably certainly ensure that both of us can revive that the implementation part of the MOU, and maybe discuss and decide how do we, as long as we can't travel to each other's country, at least the way now the new normal has been created for the whole world. You have now this video conferencing, which has become a practical reality. People knew about it earlier also, but not many of us were using it so often. So it's a sort of a good thing that has happened to the world. Thanks to COVID, that people are saving time, people are saving money in traveling and all, and at least we can start our work. So I would love to hear from you. I thought let me give you a brief about what's happening in India and how are we trying to fare in the fight against COVID. It's still a long way to go, but we are doing our best to ensure the best possible surveillance and creation of these you see hotspots and various strategies. We had 4 lockdowns in a row, and then this is now the unlock 2 that's happening in India. The things are returning back to normal gradually, but still we feel that we have to do a lot to keep the safety levels of the people very high against coronavirus. So thank you for giving this opportunity to India. We are so happy that we are talking to each other. You are a very dynamic minister. I have read so much about you, and I would love to hear from you now.
Okay. So Harsha, thank you for. I'll just check that. That's
Yes, I can hear you.
great. So firstly, thank you for everything you've done. I know your history, your career. You've had a very similar ministerial career, but you've had a far more distinguished medical career than I have. So I've recognised what you've done at the community level and at the national level. So thank you for that. And then in terms of India, I'm really privileged. I know India well. Over the years, I've had the privilege of travelling up into the mountains to Hanuman Chatti, to Missouri, obviously to some of your great cities, Delhi, Banaras, Agra, Jodhpur, Jaisalmer, right out into the desert, and to see some of the remote parts as well as some of the great urban areas. Geostrategically, we probably need each other more than ever. We've identified India as a fundamental part of the global democratic, economic, social leadership going forwards. Our Prime Minister has just this immense respect and like for Prime Minister Modi. And I think that's very important for you to understand. It's real, it's deep, it's absolutely substantive. He talks about Prime Minister Modi as being right at the top of his list of people he trusts and believes and respects internationally. But against that background, of course, we all have to deal with a more assertive China. That's an honest explanation of the world. You are living in as a frontline state, and India's role is absolutely pivotal in that, and we're completely supportive of the engagement with you. We don't see China as a hostile state, but we do see them as an assertive state. And therefore we have to be honest with them about what are the boundary lines or the red lines. And the world has seen through what's happened in COVID, but also what's happened in geopolitics, and also what's happened with Hong Kong, that they're going to play a tough role. And so we need to be collectively able to say no to them when they're stepping beyond the bounds, and as democracies to define those boundaries. And then in terms of health systems more generally, I really admire what India is doing. This process of bringing more people out of poverty than at any other time in global history. And that's an immense and important step forward, just immense and important step forward. And for us, our model is built around 4 pillars within Australia. That's primary care, and what COVID has done is it's helped us modernise our digital health offerings. So we've introduced universal telehealth. That's now at nearly 19 million consultations, which by Indian standards may be small, but by Australian standards is very large in a matter of 3 months. But our primary care, our essential goal, we have the same challenge as everybody, getting enough general practitioners and getting them into the rural areas. So that's a very large part of my focus and our new permanent secretary's focus, who was our Chief Medical Officer. Then the additional component of that is a very strong element where we're looking at Indigenous life expectancy, Indigenous diabetes, the eye and, ending avoidable Indigenous blindness, ending avoidable Indigenous deafness. On our hospital front, we have a very nice mix of public and private hospitals. And we have a private health insurance system that underpins it. And to maintain that balance between the two is immensely important. It makes sure that we're able to turn through a lot of cases to minimise the public waiting lists and give people choice. And so that's another part. The third and emerging area is mental health and preventive health. And every country in the world has mental health challenges. It's a part of the human condition. It's probably more a part of one in the first quarter of the 21st century. And that's for a mixture of reasons I don't need to explain to you, you would live it. But we are building that real focus on mental health, and the digital health offerings are part of it. And then our fourth area is medical research. So science meets medicine. And we're fortunate we have a $20 Australian billion medical research future fund, and that's focusing on rare cancers and rare diseases, breakthrough new science, medical transformation into commercialisation, and then finally it focuses on the missions. So brain cancer, stem cells, genomics, transformative areas of either need or research. That's effectively how we define it. So then, in terms of COVID, we've seen what you've done. You've scaled up the testing system on an unimaginable basis, and that has saved probably hundreds of thousands of lives, if not more. And so you should be commended for that. That's an extraordinary achievement. For us, we built our COVID response on the border control, the testing regime. We've been fortunate to have a very significant testing regime of our own. The tracing, which has been absolutely fundamental to what we've achieved, so the contact tracing, and then finally the movement restrictions. And all countries are dealing with the lockdown and then the pathway out, and sometimes it'll go in stages. And so we're now focusing on local lockdowns in areas of high need. One of our states, Victoria, you mentioned Melbourne. I live in Melbourne, and or near Melbourne, and our area is currently in a partial lockdown. So that's the national course. We're working like crazy to get a vaccine, and whether it's us, whether it's somebody else, there'll be a global licensing regime, and we're in a position to produce, and hopefully India's in a position to produce. And if there are things that we can do to help you, please let us know. On the medicines cooperation, I think we ought to, in particular, look at medicines production, what India is doing, how we can join you, how we can work with you. You've got the world's leading generic and biomedicines sector and industry in your country, and we might be able to help with digital health. You might be able to help with generics, and probably cross-investment and cross-training of personnel will be the elements.
Thank you. In fact, you have rightly talked about some of the very crucial issues, and there is no doubt that many people all across the world, they have been struck because of economic reasons, and it has certainly been a big blow to, you can see the graph around poverty. It has seen a bit of an exponential rise. But I may like to inform you and share with you that in India, in spite of it being a big, huge country, for last many months and for the next 4 5 months also, the government of India, under the able leadership of our Prime Minister, has ensured free food and free you see wheat, rice and gram and all those things to over 800 million people for continuously for last 8 months. So we could strike a very good quality balance to ensure that even after the lockdown, when we started the unlocking thing, so we could take care of the economy also simultaneously and take care of the COVID-19 also. So, and then there were huge issues in India because once we enforced the lockdown, millions of our migrant workers and poor people, they were just they got stranded at various locations in India. So we took a bold decision to ultimately shift them to their home destinations, to their native places, organized trains. It was a very Herculean task, but in a country as big as India, we could ultimately successfully do it. But we kept a very strong watch on the surveillance activities as the basic principle about tracing, tracking and testing and then treating. All those things were taken care of in the best possible manner. On the scientific front, I can say all our scientists, like most of the people all across the world, we are very proactively working for the development of the vaccine. Some of our vaccine candidates have gone into the clinical trial stages. We are wishing and praying that in the near foreseeable future we should be able to get some successful results. And also around drug discovery and also around the repurposing of drugs and development of new tools using science to actually benefit the people in the fight against COVID. A lot of activities are simultaneously going. We have isolated the virus, and over 1,000 viruses are being subjected to genome sequencing in the laboratories. The virus is being so the virus is being studied in great detail within the laboratories also. So a lot of activities, and we are part of all the WHO solidarity trials. You have rightly mentioned that issues like mental health, they were already focus areas of our government's activities, but we have made them, I think, more important now. We are working further hard to ensure that the mental health services and all those advice and counseling activities through telemedicine and various other scientific tools that we have. So that part is also being strengthened. We are utilizing all our manpower, and you have rightly said that the general practitioner and the primary health care needs to be strengthened in a big way. You have, I think, mentioned about looking at medicine production and all those things. You see, India, it's already from the point of view of pharmacy and the pharmaceutical manufacturing angle, we are one of the hubs for the whole world. Even for vaccines, we have the manufacturing abilities and capacity to supply 60% of the vaccine of the whole world's requirement. And even this hydroxychloroquine, the much talked about drug, right now we are supplying to over 100 countries of the whole world. I think the number is something like 140 countries. So all of us in our own ways, whether it is India or Australia or any other country, I think the whole world under the you can say continuous guidance of the World Health Organization and continuous collaboration with the world body, we are trying to do our best. And this is the right time when probably more of information sharing, more of experience sharing, more of active, proactive, you see, involvement of each one of us. I think that will certainly mutually help all of us in a big way. So that's why when I started, I said we have to revive the Indo-Australian health partnership in a further proactive manner at this stage. We should not wait for the corona thing to subside. As long as we can do it through a video conference, so all our joint working groups which have been made on both the sides, I think we have to decide today, and maybe our officers on both the sides, they can finalize and we go ahead on the joint working group.
So, Doctor, let me speak very briefly. I apologise. I have to meet with our media in 5 minutes, so I'll be very brief. One, yes, let's go ahead. Let's make that decision. We'll go ahead with the working group and with the cooperation. And I think we should be focusing as part of that meeting on vaccine cooperation. Secondly, on joint pharmaceutical opportunities. And thirdly, on medical research. That's a good start. I know Tanya from my Deputy Secretary in my department is on taking notes. So vaccines, pharmaceuticals and medical research is my offering to start with. Secondly, so that's a definite and complete agreement. Secondly, the important thing is that we work together on the WHO and to keep them going forwards and for them not to be afraid of China, to really be supporting this mission into China. And I really thank you for what you've done. I know it's sometimes, you've got, you're two giants that are going to help shape the rest of the century, but they can sometimes be a challenging friend. And but we'll continue to push on that. And then the third thing is we'd love, even though there may be some challenges getting here, we really want to see your cricket team in Australia this summer.
Oh yes, yes. I think I reciprocate from our own India's side, and as you said, our officers and senior officials on both sides will take this conversation between both of us forward and ensure that we keep ourselves engaged in strengthening the dynamics of our relationship with each other. And
all right. Well, thank you, Doctor. It's been a real privilege. I'm sorry that I have to sort of finish a little bit quickly, but we have.
No, it's perfectly. It's perfectly.
But you understand.
We shall remain in touch. Now these days it's so easy to remain in touch, even otherwise also. So we will remain in touch on the telephone as and when necessary. I will have your WhatsApp number also. We'll communicate regularly, and we'll take this relationship forward in a big way.
My department will send you my mobile number, and you can have it, and you can send me yours, and that would be really good.
Yes.
I apologise, I better leave, but take care.
Yes, thank you. Thank you so much. Thank you.